Hello, I'm Lauren Huberman.
And I'm Christina McLean. Welcome to All Access. Today, we have the opportunity to talk to Alexa James, who is the CEO at NAMI Chicago.
Alexa started as the Chief Executive Officer for NAMI Chicago in 2014. Prior to her work at NAMI, Alexa earned a bachelor's degree in psychology and a master's degree in social work from Loyola University, as well as a master's degree in child development from Erickson Institute. She is a licensed clinical social worker in the state of Illinois. Alexa worked with the City of Chicago on a variety of projects, including the Police Accountability Task Force, the COVID-19 Recovery Task Force, and the Health and Human Services Transition Committee. NAMI Chicago's message is at the heart of Alexa's leadership, that with courage and hope, we can bring healing to those who are overlooked in our mental health system and in our society.
Thanks for joining us, Alexa. We'd love to hear a little bit about NAMI, learn more about the programs and services that you all provide.
I'd be happy to, and I'm so glad to be here. NAMI Chicago, NAMI stands for the National Alliance on Mental Illness. We were formed in a way in which to support family members who had loved ones that were living with chronic mental illness. There's still a lot of stigma around mental illness, but even in the late 70s, there was even more. So families didn't have a lot of place to turn. We've morphed into a much more comprehensive mental health organization where we lead with our advocacy. We really program in community or over our helpline or now our 988 line to understand what the needs are, particularly in the mental health crisis system for folks, and then work in different ways to try to fill in gaps or elevate our partner organizations to do that work. So NAMI Chicago is a 24/7 organization. We are available to support people on all levels of the continuum of care. So think about like prevention, intervention, and then the postvention, or what we call recovery, which can ebb and flow. And we do this through the availability of our incredible helpline staff that are both clinicians and peers, people who are living with mental illnesses. We do this through our mental health court program, where we're sitting in the court with people who have had some challenges that have landed them in the criminal court system. And we also help people transition to psychiatric nursing homes or places where they felt like institutionalized to have more independent living. We have to remember that people kind of go through cycles sometimes, and so we are here to meet the needs wherever they are, along with their providers and their family members.
Great. And Alexa, can you tell us how you got started in your work and how you chose this career path?
Sure. The older I get, the more honest I get with this answer, I feel like, but maybe it's because of more reflection. So I grew up in a family with a lot of mental health challenges. And back then, that's not how they were identified, right? And I think that what I craved in my soul, whether it's healthy or not, is to support people who are unseen and lonely. And so I got into the mental health path because I think that was interesting. I gravitated toward that. When I graduated college, I worked with youth in care, DCFS wards. Talk about an unseen population. I was super undertrained. I did not understand the context, the systemic challenges that were facing these young women. And it really pushed me to want to better my understanding. And so I went to Erickson Institute just down the street, studied child development, and then also got my master's in social work. And I was broke after that. And I was finishing grad school and said, I need an internship that has a stipend. And at the time, it was called NAMI Greater Chicago then, but it was a smaller organization and with a few staff. And I went and I interned there and I fell in love with it. After that, I worked inpatient psychiatrically for a psych hospital. And again, I saw a real unseen population where we all were pathologizing trauma and poverty and race. And I wanted to get back to a systems approach. So got back into NAMI and I've been there ever since.
So how long have you worked there then?
I've been there 11 years.
And how big is the staff? It
Now
sounds
we
like
have
you guys do so
125
much.
people.
And is that a mix of part and full-time roles?
It is.
Yeah.
We have some part-time folks mostly working on our 988 line or the suicide line for the county. But we also have a lot of folks with lived experience who are providing that additional support. And it is so rich and so much more education for me as a leader than I certainly would have gotten in graduate school. We have public health folks, we have a policy team, and definitely a lot of clinicians too, which is a bit unusual for NAMIs.
And we know that NAMI's done a lot of work with the city of Chicago. Can you talk to us a little bit about the different ways you've, worked with the city over the years?
Sure. So sometimes I feel like we kind of elbowed our way in, but I think that that's not unusual with stakeholders working with government. But no, we've actually had like a really warm welcome into thought partnering. Our work with the city didn't actually really start until Mayor Emanuel's administration. At the time, NAMI Chicago, and still is, was partnering deeply with the Chicago Police Department to try to support their officers in what's called crisis intervention team training. NAMI Chicago teaches almost half of the 40-hour course, so we're there a lot, and it's a really interesting program. But it was one of the responses, the need for more CIT was in response to some pretty horrific events in Chicago. They realized that we had more to offer than just police training, and so we started consulting on a lot of work around mental health support. We also, through the partnership with the Chicago Department of Public Health, when Commissioner Morita was leading, she invited us in to have conversations about how our helpline could be utilized for all Chicagoans to access services. So because of that partnership, we were able to expand to 7 days a week.
And Alexa, when you talk about the crisis intervention team and the work that you do with CPD, how do you think that plays out in real time when police officers are out in the communities? How do you think they might use some of that training and education?
I've been thinking about this more and more in parallel with just the general mental health crisis that we're having, all of us, because there's so much more acuity. I think people are much more symptomatic in a way that unfortunately elicits a lot of 911 response. The intention of this program is to really humanize mental health, to really bring it closer to the police officer as opposed to being far away from it. And we really do this by evoking their own challenges with mental health, certainly in people that they love, so that they can better understand and become close. And the strategy really is like self-care. Are you well enough? Are you in a space that you are calm enough to respond to crisis, which is chaos? Yes. And what are the strategies that you're using for that? And then in the moment, tactically, we don't train them on tactical issues, but we do talk about their tone of voice, removing distractions. We talk to them about space and not cutting people off and really allowing them to vent. We teach a lot about the depth of active listening and how that in and of itself is a de-escalator. And then what do you do after to kind of shake it off and move on? But we let the officers know that this is a mental health crisis and they have been the Band-Aid for a long, long time, and that we don't have an infrastructure to support the need. However, they have the ability to build resilience and not build trauma on top of an already really challenging situation. And I think that feels good for them. I think that no matter what, they want to be that helper.
You mentioned that, we're in the middle of a mental health crisis. What do you think has created that or aided that?
I think about this all the time. I mean, I am not that fun at cocktail parties because it's all I want to do. And people are like, okay. But because I am constantly thinking about why are we here, what went wrong, and how do we need to talk about it in a different way. So I think there's several components. I think that we've never had a fully funded mental health system. We have medicalized mental health, which in one hand isn't wrong. I mean, mental health is a illness. Mental illness is an illness, and it impacts and needs medical intervention sometimes. But there are things that the medical system just cannot and will never be able to do for people that actually leads to recovery. As you guys know so well, housing is a foundation, right, to everything. Housing before you can even try to find employment. So I think that was never working, and we are fighting for access. We also have a lot more people that are more attuned with their emotions and asking for help, which is great, but it's really increased the need in the system while there was already wait time. So people are sitting in discomfort longer. I do think while we are much more aware of how we feel and we use language like, I'm going to hold that for you and give me some grace and all of these things, there's a real disconnect between our self-awareness and our ability to manage our own experiences, which is actually a lot of self-regulation. And that's what we teach the police too. I do think social media, except for podcasts, of course, except for this one. Are real disconnectors. We all know that the Surgeon General put out a report last year about the epidemic of loneliness. This is real, and it is complicated to understand that our environment, I think, is now playing a much bigger role in our mental health prognosis than biological. Remember nature versus nurture, and we know that's not a thing, but I do think that the stressors that are being experienced and the weight that we're all holding and the polarized communities that we're watching really make us feel hopeless. And to us, hopeless is really kind of the start or oftentimes the end of what can be a really complicated journey in taking care of ourselves and feeling better.
Alexa, you talked about the loneliness epidemic that the Surgeon General Vivek Murthy declared. Do you think that there's a correlation between that loneliness epidemic and the increasing rate of suicide?
100%. Yeah, and I'm really glad that you asked that, because I think that there's a lot of people who believe that suicide is just about mental illness untreated. And suicide is about hopelessness and not feeling seen and heard, and getting to a point where you start telling yourself all of these different narratives. It would be better for my family. It would be better for the world. I'm a burden, right? All of these things are happening. Suicidality can be impulsive, which is why there's so many good intervention points. And what's really scary for us is that even with all the mental health awareness, we're seeing a rise in suicidality. So we have to understand that there's a disconnect in between how we are making this just a mental health issue. And if we make it just a mental health issue, mental health can't stop this. This is really societal. It also doesn't help that some people have more access to firearms. There's a 130% increase in young people between the age 10 and 13 with engagement in suicidal behavior with a firearm. That's scary. It's scary when we talk about law enforcement, right? That law enforcement, they have tough jobs, they're seeing hard things, they have very complicated lives, and they are also members of community where we're seeing increased rates of suicidality. So it's one of the reasons NAMI's really proud to be a partner of the 988 program, but we have a lot more work to do, and it's prevention work. Obviously making sure that somebody to call and somewhere to go that isn't punitive or doesn't feel scarier than the actual circumstance they're in.
Yeah. Do you think there's any way to undo some of kind of what's been done in terms of social media and the lack of real connections with people kind of hiding behind their phones or social media to make a statement, to make points instead of having real conversations and knowing their neighbors or whoever?
Yeah.
Is there a way to undo that?
Yeah, I think. But we all have to globally vote to do it. We talk a lot about this with social media policy and phones, that we should all decide that we're not going to give our children our phones and they should be flip phones until they're 16, so that developmentally they're able to consume what's kind of difficult to consume on the internet. I think we're gonna have to reteach people how to have conversations. It is incredible to me. I was around a bunch of teenagers, which it sounds like you guys also were last weekend, and they communicate on their phones to each other. They sit next to each other on their phones, and it's so interesting to me. And so there's also some skills that have been lost, and I think that it's really important that we start to think about that in education, particularly with student populations that are trying to engage in helping professions. They're really missing that element.
We also wanted to talk to you a little bit about mental health and how that impacts people in terms of their employment. So what do you think some common misconceptions are around mental health and how they might cause barriers to employment, or just even perceptions that employers might have around mental health?
Mm-hmm. Well, I think for individuals who are living with a chronic mental illness like bipolar disorder or schizophrenia, they may think to themselves, I'm not employable, I can't get a job, which is totally wrong. I also think that there is some education to be had around working and still receiving Social Security income and benefits. I think a lot of people feel afraid to make a certain amount of money, which can be a barrier, certainly. We want that diversity in the workforce. It's super beneficial to make sure that people know that they can join the workforce. I think for employers, there's so much. There's a real lack of fluency and strength that's consistent around HR departments, around laws and obligations. I think that there's a hesitancy to engage in people's accommodations or offer that early on in the process. Employees are really managing a high rate of turnover and retention issues. I also think that employers don't know then what to do once you get there. Not everybody self-discloses their mental health condition in an interview, and you're not allowed to ask. But we do know that the workplace can be a place that can mitigate stress and really help people heal. But it also has been showing us that it also can deeply harm people. And so folks leave or get stressed and their stress tolerance can't be managed, and they interpret that as they failed. I think that there's a lot of opportunities now, and I think employers are reaching out and saying, what should I be doing differently? How should I be experiencing this differently? And the truth is, it's going to be investment. It's going to be some reorg, and it's going to cost a little bit of money. But I think the ROI is quite strong.
And what are some common reasonable accommodations you've seen in the workplace?
Breaks, just building in breaks post particular meetings or experiences. Some people want an office. Some people want accommodations to work remote. Some people want accommodations about being able to utilize more time for their therapy appointments, for example. Headphones, maybe different kinds of keyboards that feel more like accessible or softer. Bringing their pets to work have been one. And also some accommodations, or maybe it's less about accommodations, it's more about communication strategies, but really sitting down with your new employee and saying, like, what does it feel like to you when we have conversations about feedback? What will you need in this situation? Where would you prefer that to happen? And just giving them something to think about so that they can bring some of their power into those conversations too.
With somebody with a physical disability, we talk with our job seekers that that's a form of disclosure. If it's something that's physical and could be observed. If it's something that's invisible, that could fall into the category of mental health, for example. Do you have any particular philosophy on disclosing? How do you kind of think about when to disclose, if to disclose, have those conversations?
It's a good question, because I certainly don't think there's a right way to do this. I think this is incredibly courageous, because we still don't know on the other side how someone's going to feel that information. Because I've heard from folks that shows lack of boundaries or this, that, and the other. Now, at NAMI, it's different because everyone talks about their mental health diagnosis when they interview or, whatever. Yeah. So it's pretty normal for us. What I would encourage people to do is first think about, has anything in the process of application given me, the job seeker, a red flag that this is not an inclusive environment, right? So we ask things on our intake before we're even doing phone screenings about stress management and accommodations and things like that. I talk often about law enforcement, for example. They're asked when they're applying about history of psychiatric illness. And I don't think it's because they're then going to be given a reasonable accommodation. I think it feels like to them it's an opportunity to kind of get people out of the running. And so I think that can give a lot of information too. What does this feel like? I think that we always ask everybody in interviews, for example, how do you manage your stress tolerance? And if they're like, I don't have any, they're probably not a good fit because there's lack of insight. So I think it's both ways. I think that if you feel like it's important to share because it will advance the understanding of this community, share it. I think it doesn't have to happen in an interview process because you already feel vulnerable enough. But I do think that it's important to say, can I talk to other people in the organization before accepting this position about the culture of wellness or things like that, and do some of your own investigation.
And what are some ways that NAMI supports their staff? I would imagine you have a pretty good mental health culture.
That is our top priority. We survey our staff every year, and then we are responsive in the ways that we present policies, programs, et cetera. We have a full-time senior director of wellness who acts as our chief wellness officer. We decide on the percentage of spend every year that is devoted just to employee wellness activities, whether it's connection building, food. We have days off every month, even if it's not a holiday scheduled. We provide wellness hours for folks where it's if you're working, you're going to get a TISC. And we also have a senior wellness manager who does breath work, yoga, and kind of decompression with folks when necessary. So it's all there. What we ask is that people have the insight to know when they need it.
So, Alexa, you've done trainings with MOPD before, and it struck me that you've always shared about your own mental health challenges or given examples from your own life, and it seems very genuine. And why are you forthcoming in this way? Why is that part of your approach?
It's new. I actually think that my self-disclosure started quite recently. I mean, people around me knew that I have anxiety, but I also feel like you can throw around anxiety at brunch and it's, it's so normalized, but it's really hard. But I thought, like, why not? Why not? I think that I sometimes struggle as a professional social worker between, am I using my social work skill here or am I using like my lived experience? So yeah, I've struggled with depression probably as long as I can remember. I actually didn't even realize that's what it was because it was so normalized to me, if that makes sense. Like, I am here teaching about it and the signs and symptoms. I just thought I was chronically like a tired, stressed person because of course you are. You've a job and kids and whatever. And I've done all types of different treatments and figuring it out, but it's real and it is wild when you're in the depths of it, like how it lies to you. You have a very different perspective of who you are and who other people you think that they are to you and how lonely you are. And I think that if people can see that for the most part, I would call myself like successful in my career. Again, part 2 is all the mistakes I've made. I want them to know that like, you got this. And like, we're better leaders, hopefully, or better mentors or colleagues because we know what that feels like so deep down, you know? You know, we talk a lot about like illness and like symptoms and acuity and how hard it is. But I also think that without adversity, and a lot of adversity for people comes from the system that they're born into, unfortunately, right? And a lot of adversity also comes from our mental health journey. And with that, you can build resilience and actually be stronger, more confident, which I also think if done well, if nurtured and supported, then that's the outcome, right? Because if the outcome was so awful and we felt so ignored, and then we wouldn't be more likely maybe to share and be open.
That's true. I try to at least like skim the Harvard Business Review, like the tips that they email. And there are a lot of topics around mental health and being a manager and sharing and how to build empathy among your team. And I think that part of building empathy is, of course, sharing about your own vulnerabilities. And I think that's hard. I mean, I don't know if I do that, if I do it well, if I do it not enough. Honestly, I'm really not sure, but I do try and be empathetic, but I think it's a hard thing to really be vulnerable in front of, you know, like your team or your whole staff in that way.
Well, because you're juggling. You're empathetic all the time. It's like in your soul. How you look at people, how you listen, like it exists. So when you're doing it all the time, sometimes it's hard to distinguish, am I doing it like on a level 10 or a 2? And also you're doing a lot of service delivery. And so you have to be careful too about like boundaried interactions so that they are getting the most from that experience, right? And so sometimes it's not always appropriate to be like, oh my God, me too. Do you know?
Yeah.
Right? Because then it changes sometimes the efficiency of that. So even I think the fact that you're asking, and all managers should be asking, am I demonstrating empathy, which means am I finding shared connection? You don't have to say it out loud. If you find it and you see it, I think that's communicated. And I know it's super like crunchy and like kumbaya to be like they can feel the energy. But I think that like listening intently is not just keeping your mouth shut and your eyes open. You know, there's something there.
And I know that one thing you talked to us too about was expressing like where you are in terms of like colors. Like I'm in the red right now. I've tried to use that more with my kids. Like not exactly that, but just like mommy's like really tired right now or I'm hungry or something. And like just please give me a minute, you know, so thank you. Being able to communicate how you're feeling is just so important in relationships. So I wanted you to know I'm using that outside of work as well as in work.
I'm trying to use that too. So everyone who's listening, we did this exercise during training about like kind of naming how your feeling state, and we articulated it with colors. So green was like, I'm productive and well rested and I eat a smoothie instead of a burger, you know, whatever. And yellow is like, oh, I'm starting to get a little bit agitated and dysregulated, maybe short with people. And red is I'm in a full kind of crisis, however that experience is for you. And how do we move through those colors? And a lot of it is the practicing of articulating the state you're in to the people who you trust. I think as parents, I don't know if you feel like this, that we were socialized that you don't share stuff with your kids. I am like the opposite of that. It is, how was your day? This was hard. I had a really difficult conversation today. Mom feels a little bit tired. I'm going to go in the basement and work out. It doesn't mean they leave me alone or like they come up and dinner's prepared. But I do think that them seeing us too as human isn't weighted on them. It's just like I am talking through how I'm going to practice self-care.
I think being forthcoming is definitely a new thing among people working in companies and organizations and parents, like you said. I mean, I don't think that's something that's been kind of a standard practice for very long. And I think it's good to model that and to have more exposure to that.
Yeah, and just because we all may have something, right, some anxiety or some of this, or I think back to your point around, shouldn't all organizations just be doing this anyways, right? Because I do think that we don't want to see our mental health as a restriction or as a way to isolate us from participating fully. It may just make things harder and it may make things feel heavier at times. And so it doesn't mean that that's hard stop. And I think that some people are getting into this place where they're getting a diagnosis and they're like, that's why I can't do any of this. That's why I need this, as opposed to like thinking about this as an opportunity to kind of improve our overall wellness and engage in ways that are helpful. Just like if somebody had asthma, right? They wouldn't say, I'm never going to be active. They would say, I'm going to figure out how I can be outside in the spring or maybe even go for a run.
Yeah, and I think like to that point, I mean, if you think about the city of Chicago and the resources and services that we have in the city, like what would be your dream if we were able to have X number of services or types of programming? What would that look like for you?
Well, I think that for me, it would be anybody who is help seeking, has somebody, a no barrier, accessible space or phone number to call and connect with, where they get out of that situation and pretty immediately feel seen. That doesn't mean that there's a curative experience, right? And that all of us have enough mental health fluency and literacy that we can help direct people to resources, that there isn't a wait list, that the quality is superior and accountable. There's actually a real lack of accountability in the mental health system, and that we really move away from using restrictive environments to, I'm doing quotes, heal people, really divorcing ourselves from the idea that people can't live in community, and providing almost like palliative and hospice elements of mental health services to folks who may be in stage 4 of their illness and need additional support. And then lastly, of course, housing for everyone.
Yeah, absolutely. Yeah, I mean, I think there's a lot of people who are homeless or unhoused living in the city, and I would imagine mental health is a huge factor and barrier in terms of, helping them move forward and find permanent housing and find a job, the things that all of us want.
Right. Right. And a lot of people are not diagnosably sick with mental illness or substance use disorder when they are first becoming unhoused or homeless, but certainly, I mean, we would all become unwell in a situation where we have that level of unsteadiness and we don't feel like we have the capacity to go into clinic when, we don't have a place to go home to or keep our medication or feel safe. I think that we have to remember that housing is part of healthcare and it's absolutely part of the recovery model. That's inclusive, too, of spaces where people may be living where they feel unsafe in their home or where they don't feel safe in their community. All of these things are real barriers to making people feel like they have access to even utilize or start to utilize the tools, because that feels tertiary. It feels like a luxury when their foundation hasn't been met.
Yeah, absolutely.
Alexa, earlier you mentioned working out as an example of self-care. What are some other ways people practice self-care?
Yeah, so we say movement, rhythm, meditation, slowing down. Self-care is something that you can do all day long. It doesn't have to be like an hour. And it's really about feeding your body and nourishing your body. So what that could mean is always having a water bottle with you. It can mean making sure that you're waking up in the morning and thinking a little bit about what you may need to do and how you can space out some quiet, if that's helpful for you, or when you can make that connection that feels authentic. A lot of this really does require some plan, which I know is hard. But even like today, I don't have an opportunity for like traditional self-care practice. And so driving from my office in Ravenswood here to downtown, I just turned off the radio and just had some quiet. So it's even things like that. Some people would like to think about transitions, that there's always 5 minutes between meetings. This back-to-back thing is so outrageous and everyone's doing it. Making sure that you have food to eat or access to food to eat, and music and spirituality is also an incredible element to the recipe of self-care.
Yeah, those are interesting tips too.
Well, we know May is Mental Health Awareness Month. Mm-hmm. What are some ways that you or NAMI are celebrating or honoring it?
Every day is mental health awareness for us. We're trying to get into the community more, do some trainings, do some advocacy pushes. It's also, we're nearing the end of session legislatively, so we're supporting, I think, 17 bills that hopefully will expand access. And just making sure that people really know, as a takeaway, you don't have to know what's going on to call us. You don't have to have a diagnosis. You can just be like, I need some help today thinking about what self-care I should do. We are, really just trying to be that for folks. And so what we say to folks for May is this is really an opportunity to explore mental health if you haven't before, or maybe re-engage. If maybe you broke up with your therapist a year ago, maybe it's time to think about what do you need for this summer. So yeah, and being outside, hopefully May is not snowing. You never know.
And also, what advice would you give to someone who is considering a career in the field of mental health?
We need you. We're recruiting. What I would say, honestly, is do this work and know why you're doing it first, because it will activate you in ways that are hard. And also, do not restrict yourself to one particular area of study. Something that NAMI wants to do in the future state when we get a huge donor or something is have an interdisciplinary training program that folks in public health know what peers are going through and peers understand the clinical side of it. And I think it's really important. That's why social work to me is so interesting, because it's really focused in social justice. You can do a lot of different stuff. So I am really inspired, honestly, that I am seeing all the time the incredible commitment from people who work in this field, who don't have to be clinicians, like you guys and your team, that are so honestly and authentically really trying to make this world better and leave it better. I'm really proud to be in this partnership with you guys. It really does. It lifts my soul when I get to see your team and be around you guys. So thank you for really probably enhancing mental health for folks that you work with more than you know.
That means a lot. Thank you.
Absolutely. I feel very lucky to have you as a partner and to have NAMI Chicago as a partner.
We're here for it.
All right, Alexa, thank you for being here today. As always, we've really learned a lot from you and appreciate the time and coming out to talk to us.
I am so happy to be here, and you guys are so cool. I'm fangirling the show you have anytime. My mental health feels bad. This was actually self-care for me.
Yeah, I
This
see
was really
that.
good.
I can see that.
Thank you.
I feel better too.
Good.
I'm in the green.
Yeah,
Good.
Me too. This
What
was
about you,
excellent.
Alexa?
I totally am in the green.
Thank you.
We are looking forward to part 2. Mistakes Alexa James has made
Yes, as a leader.
throughout her life.
Yes.
Oh, okay.
We should have call-in.
your whole life.
We could have people calling in. My mother will probably be the first.
Oh my God, that would be amazing.
It would.
All our mothers
So
could do it.
funny. Yeah, but this was great.
Yeah.
Thank you for joining us for this month's episode of All Access. Be sure to check us out on social media at MOPD Chicago.
Special thanks to our executive producer, Commissioner Rachel Arfa, the City of Chicago's production team, our sign language interpreters who helped to make our podcast accessible, and our special guest today. See you next time.